Well, the journey, well, it was like a roller coaster ride. In fact, the first year in Canada, I don't see any clear future for us here. It's like, what do you call it? I almost quit, actually. I don't mind the financial difficulties, but it was like the emotional.
The seeds are planted, with lots of effort, with different ideas, convergence of people who have the interest. And I think it was also the right environment because there was a need. All of a sudden, a lot of community centers were looking at finding innovative ventures or projects that can be done not just alone, not by itself, but also with among all the agencies, funders.
We just knew that this was a mission we would accomplish, that we would find a pathway of providing services, providing required interventions, not forcing individuals to recreate their whole learning, but to only take the learning that was required.
We knew that it was really needed and that the system needed it and the government needed it so that people were contributing their skills back into the economy rather than being wasted as a resource in the healthcare system.
But what CARE was doing was giving them the opportunity to continue what they needed to do in terms of continuing with their livelihood, but coming into a program, completing it, and then just moving seamlessly. And that was what was so special about it, is that the coaching, the sort of providing the supports, the necessary seamless approach from one step to the other. And that was what was unique and made it successful.
And when you think of nurses, you think of the care they give you. And we really saw this as the care that we're giving the nurses to get back into the program and to get it back into the regulated employment of nurses. So once we came up with the care, finding the acronym the words that fit with that acronym was quite easy. So it was when it was suggested, everyone said yes, that's the perfect name.
What was very impressive for us at that time as consultants is that it's not very often that you come to work with a consortium, a group of organizations represented by individuals who are functional as a team. And what was very distinctive about this group of people was that they really worked well and that they were all very clear on what their common goal was. And you didn't really sense any personal dynamics. People were very focused and they took up the responsibilities that were assigned because clearly it needed to be a team approach. It couldn't be just one player.
CARE was able to knock into the doors of the colleges. We have partners with Ryerson, with George Brown and Centennial in our beginning of this project. And it was the beginning for all the colleges to get involved in internationally educated profession.
When I see these applicants, I still get or hear their stories. I get so emotional knowing where it started. Had nothing been done, these 1,000 nurses would have been underemployed and maybe working in jobs, that they have more than the qualifications to do. So it's really very rewarding seeing where CARE has gone and what CARE has done for these applicants.
First couple of weeks that we got our phones hooked up, I started receiving calls from healthcare organizations and some of the downtown teaching hospitals saying, how can I get my hands on your nurses? And recruiters who were really trying to look at sort of alternative recruitment strategies so that they could meet their labor force needs.
So each time they identified a need, they then very strategically partnered with those that could help them bring that forward. So I think the key success is really staying true to their overall objective, meeting every goal that they set, and then raising the bar and meeting the next goal. So I think spreading to other jurisdictions from Toronto, so going to Hamilton, going to London, going to Windsor, going to Peel, to other centers where our internationally educated nurses were immigrating and setting up as their new home. So they've very visionary, forward-thinking, and I think that's been their success.
They were so kind, very helpful, and their help were really efficient, I guess, because they were able to tell me which ways I should go, what should I do exactly until I get to my goal.
It's one big family where you feel at home and you can navigate the cultures of Canada, and you can share with other friends about the problems you are going through. And for those who are looking for jobs, we share, we network. When care helps one person, it helps the whole family.
And the care gave me very good and very valuable opportunities, such as the job shadowing. If it's Canada my home, here is my second home. So care is really, say, my home.
Like, it's almost like a year of continuous support from Care for Nurses, from the preparation for the exam until I got my first employment, like step by step.
There's still lots to do. This is not to suggest that we're going to stop here, right? I mean, a lot more places would require, efforts like CARE to help the IENs in the local communities. But not only geographically we're talking about, but also, what Flora and Julia mentioned in terms of the collaboration, the partnership, and also the systemic efforts that we can make. That can be extended to so many different areas, and I believe that CARE still has a lot to do.